Pharmacology and treatment of complicated skin and skin structure infections. Skin, the body's outer covering which protects against heat and light, injury and infection. Skin regulates body temperature and stores water, fat, and vitamin D.
Compared to the bony plates of an armadillo, or the hard scales of a pangolin, or even the tough leathery skin of an Indian elephant, the thin layer of delicate epidermis that makes up our outermost covering may seem like pretty wimpy protection from the outside world. Except all we have to do is take a closer look at our silky smooth skin to see that it actually is a small patch of scaly armor. Those scales are made out of the same hard protein, called keratin, as the scales of pangolins and other animals. Of course, ours are a lot thinner, and therefore more fragile, but that isn't normally a problem, because we don't regularly need to survive this. Our scales also don't have to be super durable because our body produces a brand new layer of tens of millions of them every day. The giant never-ending task of producing this armor is carried out by an equally giant and never-ending army of skin cells in the underlying epidermis. Every second, some 500 new cells split off from stem cells at the base of the epidermis and join this army, gradually migrating to the surface of your skin as younger cells form beneath and push them upwards. The journey to the top is one of ultimate sacrifice. In order to form a protective barrier between you and the world, each cell is programmed to systematically destroy itself as it nears the skin's surface, using enzymes to dismantle its vital parts and essentially converting it into a hard, flat shield. In the process, it attaches itself to surrounding cells via whisker-like projections and releases packets of soft fat to fill the spaces between cells. The outermost layer of your skin consists of about 15 sheets of this scaly mesh, overall as thick as a piece of plastic wrap. Your flexible body armor forms a waterproof and surprisingly effective barrier against penetration by bacteria, fungi, viruses, and other unfriendly interlopers, while the acidic nature of the fats prevents similar nasty microbes from setting up shop on your skin's surface. Of course, while our skin does a great job of protecting us from microscopic threats, it's our brain, not our skin, that does the job of a pangolin's scales, helping us avoid getting eaten by lions.
Treating skin and soft tissue infections isn't the most glamorous job in medicine, but as these infections, ranging from cellulitis to abscess, lead to nearly 900,000 hospital admissions annually, it's an essential one. And with the emergence of strains of methicillin-resistant Staphylococcus aureus in the community in recent years, coupled with toxicity and inconvenience of existing antibiotic options, there's a real need for new therapies.
Staph aureus can cause almost any kind of mischief you want. We are colonized with it, we carry it with us all the time, and it's very good at causing infection.
Staphylococcus aureus, or Staph aureus, is known as one of the true human pathogens. It can cause almost any disease in any body part.
One has to be really aggressive and appropriate in treating Staph aureus infections. They're increasing everywhere, but there is a relatively higher increase in certain areas, and ours happens to be one of them.
One day in 1928, a Scottish scientist named Alexander Fleming asked his assistant to watch over his Staphylococcus aureus cultures. Fleming noticed when he returned that a colony of mold had begun to grow on one of the plates.
This is an example of true serendipity, because what most microbiologists would do when you have a contaminated plate is you throw it out. That's that experiment's shot. But what Fleming did was he looked at it, and what he saw was there was a zone, a halo around the mold colony where the Staph aureus couldn't grow. And he looked at that and he said, my, isn't that curious? And for the next 20 years, that's all that it was a curiosity.
In his Nobel Prize speech in 1945, he actually mentioned that if physicians don't use antibiotics properly, they underdose them, and the bacteria survive, they're likely to become resistant. So that was recognized very early on.
Enter the Second World War. The Axis, Germany and Japan, had sulfa drugs. The Allies had penicillin. And it shouldn't be a surprise getting soldiers recuperated and back into the battle occurred much more quickly on the Allied side than on the Axis side because we had the better drug.
Through mass production methods, America is continually increasing its output of penicillin, the new drug that effects almost miraculous cures.
And at the time, 80% of staphylococci were susceptible to penicillin. 2 years later, only 10% of staphylococci were susceptible to penicillin. 2 years, this huge jump. In 1959, the solution to the penicillin resistance was solved by the development of an antibiotic called methicillin.
By 1961, we had the first methicillin-resistant Staphylococcus aureus, which we now call MRSA.
MRSA, or MRSA, was resistant to many antibiotics, including methicillin, dicloxacillin, nafcillin, oxacillin, and the cephalosporins.
Into the turn of the new century, a new type of MRSA showed up, the community-associated MRSA. Community-associated MRSA is a problem that has developed right in front of our eyes over the last 10, 12 years. We don't know where it's going to go. So knowledge really is the basis of being able to continue the battle with microorganisms. It's just shifting to a different arena.
There are new antibiotics for the treatment of these problems. These semisynthetic antibiotics called dalbavancin and oritavancin do their job by blocking steps in how gram-positive bacteria like a staph create their cell walls. Because the drugs have a longer half-life allowing for weekly dosing, they could be a desirable option for patients and providers who will no longer be saddled with twice daily dosing of an intravenous antibiotic. Related diseases. Cellulitis is a common, potentially serious bacterial skin infection. Cellulitis appears as a swollen, red area of skin that feels hot and tender, and it may spread rapidly.
Today I want to talk to you about cellulitis. Cellulitis is an infection of the skin.
These usually start with a scrape, cut, insect bite, blister, or any other opening of the skin which becomes infected. This is a serious condition. It must be watched very closely to be sure the infection does not spread. With antibiotic treatment, the size of the red area will gradually shrink in size until the skin returns to normal. This will take 7 to 10 days. The red area should never increase in size once antibiotic medicine has been started. Often, in the emergency department, we'll mark the skin so that if the redness extends past the markings, you know to come back to the emergency department immediately for further evaluation. Occasionally, an infection might be resistant to one antibiotic, and another might need to be used.
Eczema is a term for a group of medical conditions that cause the skin to become inflamed or irritated.
Eczema, an acute or chronic inflammatory disease of the skin. Eczema, non-communicable diseases having an allergic nature. It is characterized by a variety of rashes, burning, itching, and a tendency to relapse. The causes of eczema. Currently, allergic processes are treated as pathological immune response, accompanied by damage and inflammation of the tissues of the body. The most compelling factor pointing to the role of the nervous system in the pathogenesis of eczema is the possibility of its occurrence after consequence of peripheral nerve injury.
Psoriasis is a common skin disorder that produces thick red plaques covered with silvery scales.
About 2% of the world population has psoriasis, and essentially the skin is an immunological organ and it's a target for this inflammation. So in psoriasis, the skin is growing too quickly. It gives you inflammation, thickening of the skin, and scaling. So a typical patch of psoriasis is a red, well-defined, silvery scale. And that's the common regular psoriasis that we see. There are also other things to remember about psoriasis, is that we see arthritis may be associated with psoriasis, and also in the more severe psoriasis it can impact on our cardiovascular health.